In 2014, an average of 128 people a day fell victim to the opioid epidemic in America. Opioids work to alleviate pain and are becoming more and more prescribed in America.
In circulation.
We have currently nearly 250 million prescriptions for opioids written every year. That's enough for every adult in America to have a bottle of pills and then some.
That's a lot of pills, and although some are being properly used, there are a good amount that aren't just sitting in the medicine cabinet and are falling into the hands of those who misuse the drug. But opioids didn't always used to be this overprescribed. Up until the early 1990s, opioids were highly underprescribed because doctors believed that even the slightest amount of opioids would turn their patients into addicts. But this all changed in 1996 when the pharmaceutical company Purdue developed the opioid Oxycontin. Purdue began aggressively advertising their new drug and even made a promotion video titled, "I Got My Life Back," which told the story of how Oxycontin improved the lives of 7 Americans. This video was played in the waiting rooms of physicians all across the country, thus increasing the popularity of opioids. Opioids aren't completely awful, though. They do, when given in the right doses to the right patients, provide relief from chronic pain. Opioids should be given to treat extreme chronic pain and be used in end-life care. The most common and less addictive medication are NSAIDs, non-steroidal anti-inflammatory drugs such as Aleve. The problem is, NSAIDs almost always don't provide enough relief for chronic pain patients. Additional forms of treatment include natural remedies, acupuncture, and, if possible, surgery, which can lead to additional pain. Doctors are limited in their resources to treat pain and must choose to undertreat pain with few side effects or almost completely reduce pain with dangerous side effects. This is a hard decision for doctors to make because pain is highly subjective and requires doctors to decide how to treat pain based on ethics. Attempting to treat pain efficiently is a delicate balance, thus requiring doctors to possess a deep knowledge of pain itself. Yet physicians receive a limited amount of training when it comes to treating pain and addiction. Currently, medical students in the United States receive an inadequate amount of training of only 9 hours during their 4 years of medical school in ways to treat pain. Dr. Herbert compares the opioid epidemic to asthma. People who have bad asthma attacks may need to go to the ER, but they can avoid the ER if they figure out they have asthma earlier and can be prescribed an inhaler. In the same way, asthma attacks can be prevented by a pulmonologist having a well-educated understanding of the disease and the treatment of it. The misuse, abuse, and overprescribing of opioid drugs may be limited by doctors by acquiring a deeper understanding of pain and addiction. There are 2.1 million Americans over the age of 12 already addicted to opioids, and something must be done to help them. A handful of lives already lost to the epidemic were said to could have been saved. According to the Drug Policy Alliance, the most common reason people cite for not calling 911 is fear of police involvement. 911 Good Samaritan immunity laws are laws that protect from criminal persecution of those who call 911 or seek emergency assistance because of an overdose. Washington State adopted a Good Samaritan law in 2010. An evaluation of this law found that 88% of people who use opioids said they were more likely and less afraid to call 911 in the event of a future overdose after learning about this new law. Naloxone is an antidote for overdose that works in the brain by blocking the opioid receptor sites, thus restoring normal breathing 2 to 3 minutes after administration. Establishing programs across the country to train the public how to administer naloxone and how to learn to recognize the signs of an overdose can help reduce the number of deaths due to the abuse and misuse of the drugs.
What you're looking at is pretty shocking. A heroin addict overdosing.
Well, once someone's not breathing and they're not responding to any sort of stimulus, you give them breath, and at that time, I usually administer naloxone.
These friends were able to save the life of their friend from an overdose because of the knowledge that the program had taught them. The opioid epidemic in America is out of control, and it's time that America tries to fix it. Treating pain will never be perfect because pain is so subjective, but the epidemic can be controlled by developing quality pain treatment for moderate chronic pain, increasing physicians' education on pain, implementing 911 Good Samaritan immunity laws in every state, and establishing more naloxone programs across the country. It is time that America no longer ignores the issue and does something about it.